Why are we recommending the hepatitis B vaccine in all newborns? The CDC and the Advisory Committee for Immunization Practices, or ACIP, recently said that we shouldn't necessarily be giving every single newborn in the hospital the hepatitis B vaccine, and that's because there's not great data to support it. For years, as a pharmacist, as providers, we were taught that hepatitis B is transmitted via bodily fluids, through sexual contact, through IV drug use, through bloodborne pathogens being exchanged between persons, high-risk healthcare providers. But why newborns? Why babies? Now, when mom has hepatitis B, the transmission to that child is very high. So it makes sense that the benefit of giving the vaccine to a newborn of a mother who has hepatitis B outweighs the risk of the vaccine. But what about babies who are born to moms who do not have hepatitis B? What if you know you do not have hepatitis B? What if you've been tested? What if you're not even at risk for hepatitis B? In the United States of America, we generally test women, all pregnant women, for hepatitis B. So what about the moms who don't have hepatitis B? Why are we still vaccinating all newborns if the mom doesn't even have it? Well, if you notice, the goalposts have recently changed. It used to be that hepatitis B is a sexually transmitted disease or from IV drug use. But now you can get hepatitis B from contaminated surfaces because hepatitis B can survive, the virus itself can survive on a surface for no longer than 7 days. So they're using this as a scare tactic. They've changed the goalpost to now say that your child can get hepatitis B by touching a contaminated surface. But do you know what the risk of getting hepatitis B is from touching a surface? It's essentially zero. The only documented cases of transmitting hepatitis B to another person is through IV drug use, exchanging bodily fluids, sharing razor blades or toothbrushes. So I don't recommend that anyway, regardless of having hepatitis B or not. Now, some of you are curious about daycare or having another caregiver who may have hepatitis B taking care of your child. Now, if that child is in close contact, let's say a household member, your husband, grandma, and they do have hepatitis B, the longer they're around that person, the higher the risk, because there is a possibility of a cut or wound getting contaminated with someone else's cut or wound. Like I said, sharing razor blades, toothbrushes, things that could cause open wounds in your mouth or your hands could increase the risk. So if you have someone in your household who has hepatitis B or a close contact that you know is going to be around the baby, again, risk versus benefit. In this situation, the benefit of the vaccine may outweigh the risk. But what about just general daycare? Well, the risk in the United States, at least, is extremely low. Now, just playing, going to the park, having friends, if those kids have hepatitis B and your kid doesn't, the risk is essentially zero as long as they're not sharing bodily fluids. Even in close contact, they're probably going to be just fine. The risk, again, is extremely low. It's essentially zero. Now, the one time there might be a higher risk is if a child with hepatitis B bites your child. That happens at daycare. That would be a higher risk setting. So if you know that the child has hepatitis B, your child was just exposed to hepatitis B, you want to have a discussion with your provider because now your child has an exposure to hepatitis B. The odds of them developing Hep B from a child who has it themselves and bites your child is about 2%. So there are situations where the benefit of the vaccine may outweigh the risk. But I would say that in the vast majority of situations, the benefit of the vaccine is essentially zero. And now you're giving a vaccine that doesn't have zero risk. In fact, we have no idea what the risk is because we didn't even study it. But the actual risk of getting hepatitis B from touching a surface like a grocery cart or some structure at the park is essentially zero. You know how many case reports have been documented of a child contracting hepatitis B from a surface? Zero. So we are vaccinating 3 million babies, newborns, within the first day of life every single year for a disease that they essentially have zero risk for. Now, don't get me wrong. Hepatitis B in newborns and infants is very, very bad. But if the baby doesn't even have the risk, the mom doesn't even have hepatitis B, they're not doing risky behaviors, and the risk of getting it from a contaminated surface is essentially zero, then why are we giving every single baby the hepatitis B vaccine? In all of the books that recommend giving these newborns hepatitis B vaccine at birth, it's not because of their risk of transmission or their risk of contamination from surfaces. It's because they want to eliminate the disease. And by vaccinating 100% of the population, the goal is to get rid of hepatitis B altogether. And that sounds like a great plan. But when your child is not even at risk for hepatitis B, they're just getting the extra risk of the vaccine. What we really should be doing is focusing on those people who have a risk of hepatitis B. And before the vaccine ever came out, there were about 20,000 children who developed hepatitis B before the age of 10. And now that the vaccine is out, there's only about 1,000. So we've reduced the hepatitis risk significantly. But that's not from touching surfaces. It's from recognition of hepatitis B positive moms and vaccinating those babies. Now let's get into the studies. There are 0 studies looking at the safety and efficacy of the hepatitis B vaccine in healthy babies born to non-hepatitis B positive moms, so the ones who do not have hepatitis B. There are no studies showing safety and efficacy except the one that was used to approve this vaccine way back when. And that was looking at 147 children up to the age of 10, so not even newborns. They could have all been 8, 9, and 10 years old. They followed them for 5 days after every dose, so 3 doses, so 5 days after each of those doses. They didn't see any side effects that they were concerned about. But again, they followed them for only 5 days. 5. If you want, you could say they followed them for 6 months because they had to follow them for the 3 doses. But they actually said in the study that they only followed them for 5 days after each dose. So what happened in between the doses, we have no idea. It wasn't documented. The other crazy thing is there was no control group. Every child in the study got the hepatitis B vaccine. So how do we know, compared to kids who didn't get the hepatitis B vaccine, if they were okay? And again, only 147 children. If a bad outcome happens 1 in every 1,000 doses, we're not going to see it in only 147 children. All of the other studies, all of them, every single other study for the hepatitis B vaccine was done in hepatitis B positive mothers and their infants. So the data we have to give every single newborn within 24 hours of birth the hepatitis B vaccine is based on Hep B positive mothers and those studies, not on healthy babies, infants, newborns. We vaccinate 3 million newborns every year. And now it's because there's a possibility they could pick it up at the park. Do you have any idea how well the stars would have to align for your child to get hepatitis B from a surface? So we're basically vaccinating 3 million babies every single year in the United States for a theoretical risk. It's never even been documented that a baby got hepatitis B from a contaminated surface. The only reason we know about the hepatitis B on surfaces is because in the labs, they will do studies on hepatitis B, and they found that the virus can last up to 7 days. But that's in a lab environment. That's not in real life, exposed to vitamin D and sunshine and the elements of the world. There has to be a way for that virus to get into the body. So if your child has intact skin, they don't have cuts all over their hands or their lips, they can't get the hepatitis B virus in their body. So can hepatitis B be transmitted through surfaces? Theoretically, yes. What's the everyday risk? It's essentially 0. So that is your informed consent. As a mom or dad who's having a baby, do you want to give your baby the hepatitis B vaccine if you don't have hepatitis B?